Hello, my name is Megan and I'm a graduate student at Aurora University. This is an individualized lesson plan presentation that is required for my curriculum development and assessment class that is directed by Dr. Teresa White. The focus of this presentation is on the introduction to nursing informatics, and I believe this oral presentation is a great way to get accustomed to my future role as a nurse educator. For the purpose of this PowerPoint presentation and smooth transition of key points, all the quoted information is referenced in the notes section and reference page. By the end of this lesson plan presentation, the learner will be able to define nursing informatics and key terminology, analyze nursing informatics pioneers and their role in the advancement of nursing informatics, list examples of how nursing informatics affects clinical practice, administration, education, and research, and lastly, explore and identify the different positions available in the field of nursing informatics. So how is nursing informatics defined in literature? The meaning of nursing informatics has changed drastically from the 1960s to include a more seminal meaning. In the 1960s, nursing informatics was defined as the application of computer technology to all fields of nursing, nursing services, nursing education, and nursing research. Since then, the American Nurses Association has revamped the definition of nursing informatics, resulting in a more well-defined, thorough explanation. According to the American Nurses Association, nursing informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. Nursing informatics supports consumers, patients, nurses, and other providers in their decision-making in all roles and settings. This support is accomplished through the use of information structures, information processes, and information technology. There's a combination of three components that is necessary in the realm of nursing informatics. The first one is nursing science. Nursing science can be defined as the application of knowledge acquired through education, research, and practice. The second one is computer science, which is the study of storage and memory, conversion and transformation, and transfer or transmission of information in machines. And the last one is information science, that is, the science of information, studying the application and usage of information and knowledge. The framework for nursing informatics relies on the central concepts of data, information, and knowledge. The combination of those three concepts results in decisions that guide practice. The study of nursing informatics is considered an integral part of the science of nursing, and not simply a branch of computer science that's being applied to nursing. This is based on the premises that data and information are symbolic representations of the nursing phenomena. The phenomenon of study of nursing informatics is information, meaning data, information, and knowledge of nursing. According to Graves and Corcoran, the core of the science of informatics is the commodities that computers process, data, information, knowledge, and not the computer itself. Advances in information technology have sped up efforts to implement information systems such as the electronic health record. With all these advancements in information technology, there are more and more roles opening up to nurses, and I can't stress enough how important it is that all nurses become more knowledgeable about the concepts and technology that's being used to manage so much information. So what do we mean when we say nursing informatics? What are we talking about? Nursing informatics is a way of helping in the management and processing of nursing information through the use of computers and technology. It involves research and analysis aimed at supporting nursing education and practice. Lastly, nursing informatics deals specifically with the process of gathering and acquiring nursing healthcare data. In order to fully understand nursing informatics, we must go back to the basics and understand some key terminology. In addition to nursing science, computer science, and information science, there are additional terms that are critical in the field of nursing informatics. The first one is building blocks. Building blocks is the basic part of nursing informatics, which we listed previously as the three components of nursing informatics, which were nursing science, computer science, and information science. The foundation of knowledge model is a framework in which nursing informatics is built upon. This model states that we as humans are information systems in which we are continually obtaining, managing, creating, and distributing information and knowledge both in our personal and professional careers. The foundation of knowledge model leads to the next four terms. Knowledge acquisition refers to how knowledge is obtained. How did we get this knowledge? Knowledge dissemination is the sharing of knowledge. Knowledge generation is creating and evolving knowledge based upon experience, education, and guidance from others. Knowledge processing is gathering, evaluating, handling, and transferring knowledge. Information technology is anything related to computer technology, such as networking, hardware, software, and even those individuals who work with these technologies. An example would include IT departments. So what does all of this mean? This leads us to the last and most important term, professional development. This is the end result that comes from accurately using the foundation of knowledge model. This process can facilitate professional development and the ability to apply evidence-based practice decisions within nursing care. And if the results are disseminated and shared, can also advance the professional knowledge base. So what exactly are nurse informaticists? Well, first off, they play an integral role in decision making and improving the quality of nursing practice. They are expert clinicians with extensive clinical practice background, meaning they have experience in utilizing and implementing the nursing process. I know you have discussed in detail the nursing process in other courses, but just a brief review. The nursing process consists of 5 steps. The first step is assessment. This is where the nurse focuses on identifying problems, which can be reached through collecting subjective or objective data. After collecting enough data, we move into the second step, diagnosis. This is where the nurse develops a theory or hypothesis about the situation using the information collected in the previous step. Next is the planning phase of the process. Here is where a plan is developed and we focus on starting to establish goals to improve the condition and outcome. Once a plan is developed and we have a clear, concise idea of where and what to do, we move into actually implementing the plan or goal. Interventions and care are put into action and continuity of care is assured. The last step of the nursing process is evaluation. It is in this step that we determine the status and effectiveness of the nursing care that we've provided and determine whether improvement is occurring. If not, then we circle back around to the planning step, we modify and make changes and continue through the steps again. Nurse informaticists are skilled nursing clinicians in promoting the nursing process. So not only are they implementing it, but they're promoting the process for better outcomes. They possess expert analytical and critical thinking skills, and they understand patient delivery workflow and integration points for automated processing. They have additional training and experience with information systems. They are excellent project managers because of the similarity between the project management process and the nursing process. Many times they are certified in nursing informatics by the American Nurses Credentialing Center, or ANCC, which you'll hear me talk about throughout this presentation. Lastly, they assist in the integration of information technology into the workflow of nurses. Before we begin to discuss where nursing informatics came from and who were influential roles in the development of informatics, I came across a quote by Winston Churchill in my research that describes the movement of nursing informatics from the beginning to where we are now in 2016. Winston states, "The farther back you can look, the farther forward you are likely to see." Although there is new and innovative technology that has improved the field of nursing, it is always crucial to review the history and how it came about. Next, we're going to go back in time and take a look at when nursing informatics emerged and pioneers that played an influential role in where nursing informatics is today. Nursing informatics originated as a field of nursing in the 1960s, but it wasn't until 1992 that the American Nurses Association decided to make it a separate and distinct nursing specialty. The rise of this specialty coincides with an increased use in the importance of technology within healthcare worldwide. Those early adopters, developers, and innovators of technology in nursing practice became known as pioneers of nursing informatics. The Nursing Informatics Working Group, or NIWG, believed it was of the utmost importance to preserve the history of those individuals involved in making nursing informatics what it is today. So the NIWG formed a committee and conducted videotaped interviews of nursing pioneers. They then collaborated with the American Medical Informatics Association, or AMIA, that granted them permission to use their website to station the pioneer videos. The archived materials are now housed in the National Library of Medicine for future study. Here we have pioneers in the field of nursing informatics. There are an abundance of nursing pioneers, so I decided to select 6 individuals who have really helped develop the world of nursing informatics, which we will also discuss their contributions. We will discuss Patricia Abbott, Susan Newbold, Judith Warren, Betty Chang, Suzanne Bakken, and Marion Ball. So who are some nursing informaticists, pioneers that have, and what have they contributed? Patricia Abbott has a PhD and belongs to the FAAN and FACMI. FAAN stands for Fellow of the American Academy of Nursing, where this is where honorary individuals such as nursing leaders in education, management, practice, and even research are recognized for their extraordinary contributions to nursing and health. FACMI stands for Fellow of the American College of Medical Informatics, which elects individuals who have made significant and sustained contributions to the field of medical informatics. She is best known for her early work in helping to establish the nursing informatics specialty. Her areas of interest include e-health, informatics in health and healthcare, global e-health, and implementation science. Patricia was a member of the author team for the original scope and standards of nursing informatics practice with the ANA. She also developed the first certification exam in nursing informatics with the ANCC. In a videotaped interview, Patricia explains what her contribution to nursing informatics is. Patricia states, quote, "I believe my major contributions to the field of nursing informatics center on advocacy, policy, and education. I sort of came out of bedside clinical involvement in nursing care. What I then became was an educator, and so spent 6 years as the director of the graduate programs in nursing informatics at the University of Maryland in the School of Nursing. And I believe the program was hugely popular at that time, massive amounts of students. It was the largest in the world. So I like to think that maybe I played just a small role in creating this 3rd, 4th, 5th generation of nurse informaticists that are out in practice. So I think really it was maybe my enthusiasm and my passion for what I do that maybe infected a fewer organization of folks that are now in this world." End quote. Susan Newbold has her PhD and also belongs to the FAAN and FHIMSS, which stands for Fellow Healthcare Information Management System Society. Susan founded Caring, which is a large geographically dispersed nursing informatics group, back in 1982. She then went on and conducted the first hospital workshop in 1983 called Computers in Nursing Practice. In a pioneer interview, Susan states that her contribution to the field of nursing informatics has been in the area of networking and organization. She goes on to explain, quote, "One of my idols, Roy Simpson, has deemed me the queen of networking, and that is a very big honor coming from him because he's the king of networking, I think. But bringing people together to support the mission of implementing and furthering healthcare informatics is really something I think I do well." End quote. Next we have Judith Warren. Judith Warren has a PhD and also belongs to the FAAN and FACMI. She developed an electronic health record software to help teach students how to analyze data from virtual patient case studies, simulations, and clinical experiences, while also developing informatics competencies. This software has been used in over 60 schools of nursing, medicine, and pharmacy. Judith was a very active member in terms of committees and responsibilities. It started back in 1994 when she was appointed chairperson of the ANA's Congress of Nursing Practice Committee. That led to what she believed was her contribution to nursing informatics. Judith explains, quote, And then through some of those efforts, we really began to refine how ANA recognized nursing terminology. Started placing that within looking at international standards for things like that, end quote. Soon after, she became a liaison for SNOMED, which is a standardized multilingual clinical terminology that is used by physicians and other healthcare providers, which we use today. Next, we discuss Betty Chang and how she has made the change in the world of nursing informatics. Her credentials include a Doctor of Nursing Science degree, Certified Family Nurse Practitioner, and belongs to the FAAN. In 1980, Betty designed a computerized educational program for undergraduate students and a nursing diagnosis clinical support system for research. She was also instrumental in developing the first computerized learning laboratory and program for teaching nursing informatics. She served as a member on the ANA Council of Nursing Applications Committee, and when asked in a Pioneer interview what her major contribution to the world of nursing informatics is, she stated, quote, "My contribution would be drawing attention and awareness of nurses to the use of decision support in making nursing diagnoses, and subsequently in selecting nursing interventions, and finally in the evaluation of care," end quote. Susan Bakken, she has a Doctor of Nursing Science degree and belongs to the FAAN and FACMI. She has conducted federally funded clinical informatics research for more than 25 years. Although previously there were nursing pioneers and individuals who helped develop clinical terminology, Suzanne was technically the first person that had the formal preparation through a postdoctorate degree in medical informatics. She was able to obtain knowledge representation issues and what it meant to move from having lists of terms to representing concepts in a formal way that allowed computers to do automated processing. When an interview inquired what contribution Suzanne has made in the history of nursing informatics, she had this to say, quote, "Nursing is a practice discipline, and we need to be able to build knowledge out of the practice, and we can't do that unless we get the language of nursing incorporated effectively into computer system in a way that supports nursing practice," end quote. Like Suzanne, Marion Ball received a doctor's degree. However, instead of receiving it in nursing science, her primary focus was in education. In the 1990s, Marion simultaneously served as president of the International Medical Informatics Association, or IMIA, while promoting nursing informatics groups. She is also a founding member of the TIGER Initiative. TIGER stands for Technology Informatics Guiding Education Reform. The TIGER Initiative is focused on helping the nursing profession to adopt informatics tools, principles, theories, and practices that make healthcare safer. It makes it more effective and efficient, patient-centered, and ultimately equitable for all stakeholders. In regards to Marion's contribution to nursing informatics, she explains, "I think I have had a little bit of influence in helping and promoting the profession and bringing some people into devoting themselves to nursing and informatics." She acted as a mentor to several nurses going into the field of nursing informatics, in which she found very rewarding. In the past, she has co-authored and edited a series of textbooks on healthcare informatics, to which she believes has contributed to others' learning and ultimately earning a degree in the field of nursing informatics. In the last decade alone, there's been a significant increase in the demand for nurses whose knowledge of nursing and specialization in informatics contribute to nursing practice, leadership, education, and research throughout the U.S. Nursing informatics can be applied to all areas of nursing practice, which include clinical practice, administration, education, and research. As I just mentioned, nursing informatics can be used in all areas of nursing practice. So the next couple slides are broken up by nursing areas and have examples of how informatics has enhanced the field of nursing. First, we look at what informatics has provided us in nursing clinical practice. We now have work lists to remind staff of planned nursing interventions. Many times this is found in an institution's software systems such as Meditech, Epic, or Allscripts. There is computer-generated patient documentation, which goes hand in hand with electronic medical records or electronic health records. Within the electronic health records, we are able to communicate doctor's orders remotely, retrieve laboratory results instantly, and perform automated nursing documentation. Telehealth plays a significant role to nursing informatics. Telehealth has provided us with transmission such as faxes, EKGs, remote imaging such as CT and MRI scans, and even x-rays. In nursing clinical practice, informatics has given us the opportunity for interdepartmental communications such as ordering laboratory tests or equipment. Another example is the technological advances that allows ambulance personnel to communicate with emergency staff regarding incoming missions from the field. That allows acute care staff to prematurely prepare for an arriving patient, thus improving patient outcomes. Another way informatics has been beneficial in nursing clinical practice is by using monitoring devices. These devices record vital signs and other measurements directly into an electronic health record. An example of this would be glucometers, where blood glucose readings can be obtained and then are automatically transmitted into the patient's electronic health record. Another instance would be of patients who have arterial lines placed for frequent and accurate blood pressure readings. Technologies that monitor and capture cardiac events, such as Zio patches and Holter monitors, are other examples of monitoring devices. The readings are directly transmitted into the electronic health record, where interdisciplinary staff can access the information and continuity of care can be maintained. We have computer-generated nursing care plans and critical pathways. This is a management plan that shows goals for the patient and then provides the order and timing of actions that are necessary in order to effectively achieve these goals. It also provides us with reminders and prompts that appear during documentation to ensure comprehensive charting. An example of this would be electronic health records prompting the user to administer a pneumonia vaccine, if applicable, to a high-risk patient needing it. Or the electronic health record prompting a sepsis protocol for a patient with a sepsis diagnosis, ensuring that the patient will receive appropriate antibiotics and appropriate lab work for optimal results. We also have biometrics, which nursing informatics has increased security to protect healthcare information. Administration is another area of nursing practice that informatics plays a significant role in. By implementing informatics in administration, facilitating and managing change has become more efficient. Essentially, what change management does is encourage planning, especially between work groups, documents changes in process, evaluates the changes as they come in to see who else needs to be notified, and to place the change on a schedule. With advancements in technology brought automated staff scheduling. This has allowed nurses to manage their schedules and has even reduced the need for incentive costs. Many benefits have stemmed from implementing self-scheduling by allowing better predictability, better flexibility, and has even freed up nurse managers to perform other tasks. It has been financially beneficial and staff can be used to their full potential. Nursing informatics has introduced the healthcare system to email for improved communication. This has not only saved time, but has saved financially as well. Email is the most extensive form of communication in healthcare. Cost analysis and finding trims for budget purposes plays a crucial role in the field of nursing. In the administrative setting, nursing informatics helps support cost savings and productivity goals. It has established programs that monitor and recall financial and budgeting trends to help gain awareness and build accordingly. The last role nursing informatics has played in the administration setting is quality assurance and outcome analysis. The goal of this is to improve the quality of a system or institution by comparing results of performance with standards and then identifying strengths and areas for improvement. Next, we go on to discuss the role nursing informatics has in education. Computerized record keeping. We now have computers that effectively manage data and find trends. This includes the ability to provide historical or current data reports. This provides information on request without the burden of trial and error, and it also allows for easy access and retrieval of information. Nursing informatics has provided us with an array of technological tools that help enhance the learning process. New innovative tools such as interactive video technology is especially useful for individuals who need to learn remotely and allows for a large number of learners to be taught simultaneously. Informatics has provided us with the ability to have distance learning, such as web-based courses and degree programs. It has introduced us to the possibility of internet resources, including nursing CEUs, formal nursing courses, and degree distance learning programs. Lastly, informatics has opened the doors for different teaching learning strategies as a means to comprehend and retain information. This includes presentation software that allows us to create or prepare slides and handouts through the use of PowerPoint, Microsoft Word, Excel, and many more programs. The last area of nursing practice we look at is in nursing research. Because of nursing informatics, we have the opportunity and have been introduced to computerized literature searching. This allows access to some of the world's largest nursing research databases, such as CINAHL, Medline, and ProQuest. The adoption of standardized language related to nursing terms, such as NANDA, is accessible via internet as a quick resource for healthcare professionals and aspiring nurses. Finally, we have the ability to find trends in comprehensive data. That is, data derived from large population groups and includes statistical software, or SPSS. Nursing informatics has become an essential nursing specialty with the introduction of computers and electronic health records. This has forced all clinicians to use this new technology and incorporate it into our busy days, making nurse informaticists an essential component in overcoming these challenges. There are numerous roles that nurse informaticists fill in this rapidly changing profession, such as project manager. They are responsible for planning and implementing information projects as deemed necessary. Their role in this position is to act as a liaison between clinicians, management, vendors, and informatics specialists. The role of decision support outcomes manager uses tools to maintain data integrity and reliability. I can't stress enough how important it is to have a basic nursing knowledge for this role. Assuming the role as an educator is fundamentally the most important of the positions. How a nurse informaticist educates and trains the end users in terms of innovative technology will determine the overall success or failure of a product. Taking on the role of the researcher is exactly what it sounds like. The nurse is in charge of conducting research to create new informatics and clinical knowledge. This may include basic informatics research, or it may extend into developing clinical decision support tools. Product developer is slightly more different than the previous roles, as it is necessary to have an understanding of nursing as well as business aspect. The product developer is in charge of designing, producing, and marketing new informatics solution. Advocate policy developer. Nurses are a key component in this role. They help build the framework of health policy to which policy development is performed at a local, national, and global level. In the role of consultant, the nurse provides expert advice, opinions, and recommendations based on his or her area of expertise. An area that is beginning to gain attention is nurse entrepreneur. It is in this role that trained nurses use their knowledge and business skills to make their own business and organization. The last role in nursing informatics that we're going to discuss is the role of clinical analyst, systems specialist. They are in charge of improving the workflow and bridging the gap between nursing and information services within the organization. In conclusion, nursing informatics continues to be a growing field for technological advancements in healthcare delivery. It promotes changes in information services to patients and healthcare providers. Nursing informatics is made up of three components: nursing science, computer science, and information science. It uses data, knowledge, and information in combination with the nursing process to arrive at clinical decisions. There have been substantial changes in the definition of nursing informatics from the 1960s until today. As innovative technology continues to develop and on the rise, the more extensive the definition of nursing informatics will become. Nursing informatics pioneers have and continue to play an influential role in where the specialty has been and where it's going. Nursing informatics provides values to nurses, patients, and the healthcare system. This includes supporting nursing work processes using technology, improving the nurse's workflow, facilitating analysis of clinical data, providing standardized medical terminology, and enabling cost savings. The future of nursing science and nursing informatics is closely associated with education and research. According to SCIBA 2007, techno-savvy and well-informed faculty who can demonstrate the appropriate use of technologies to enhance the delivery of nursing care is needed. That concludes my lesson plan presentation on the introduction of nursing informatics. I hope you enjoyed it and found it as informative as I have, and I look forward to hearing your questions or comments you may have for me. If you have any questions regarding the PowerPoint presentation, please feel free to send me a private message and I can answer any questions or thoughts you may have. Thank you.